Video I will discuss bacterial overgrowth syndrome. So in case of bacterial overgrowth syndrome, there is actually decreased intestinal motility. Due to this decreased intestinal motility, the bacteria grow in number in the small intestine, and when they grow in number, they produce these symptoms. These are bloating, most common, abdominal discomfort and distension. These can also lead to the chronic diarrhea. Also, this diarrhea contains fat content known as steatorrhea. There is excessive gas production because when bacteria ferment carbohydrates, then they produce more and more gas. So, excessive gas production, weight loss because of malabsorption and diarrhea. Malabsorption features. There is especially vitamin B12 deficiency because these bacteria utilize this vitamin B12, and also these bacteria increase the production of folic acid. So folic acid levels are increased while vitamin B12 levels are reduced, leading to macrocytic anemia and neuropathy. There may also be iron deficiency anemia. Fat soluble vitamin deficiency can also be seen. These include A, D, E, and K. Protein malabsorption leading to edema and muscle wasting. So these are the features that are produced when there is actually proliferation of the bacteria in your small intestine. Clinical clues. Symptoms worsen after meals. When you take antibiotics for any purpose, then there is relief of diarrhea. Patients often have motility disorders, anatomical abnormalities, or low gastric acid production. For example, patient has diabetes and patient has decreased motility leading to increased proliferation of the bacteria in the intestine. Or if the patient uses PPIs, and due to which these PPIs there is low gastric acid production, and therefore when there is low gastric acid production, then it cannot kill the bacteria in your gut. Diagnosis. For diagnosis, you go for glucose, hydrogen, or methane breath test. This is positive. There is positive rise in hydrogen or methane after intake of glucose or lactose. So patient takes glucose or lactulose. So when these are taken, then there is positive rise in hydrogen or this methane in the breath. Therefore, these can be detected as hydrogen or methane breath tests. Furthermore, you can go for jejunal aspirate. If jejunal aspirate and culture shows more than 10 raised to power 5 CFU per ml, then this is gold standard for the diagnosis of bacterial overgrowth syndrome. Now, how will you manage this? You have to treat the underlying cause. For example, if you have diabetes and you have hypomotility, then you should give motility agents that increase motility. For example, metoclopramide, domperidone, or cisapride, etc. And then you go for treatment of the bacteria for their eradication. For example, rifaximin, this is a first line antibiotic. It is given as 550 mg 2 to 3 times daily for 2 weeks. Then for methane predominant small intestinal bacterial overgrowth, you should go for rifaximin plus neomycin. Rifaximin 550 mg TID plus neomycin can be used in combination for 2 weeks. Alternative agents can also be used like metronidazole, ciprofloxacin, coamoxiclav, tetracycline, etc. And you should treat underlying cause as I have told you. For motility, you can give procalopride, metoclopramide, low dose erythromycin. You should stop PPIs because gastric acid hyposecretion can also lead to the bacterial proliferation in the intestine. Correct anatomical issues, strictures, blind loops, etc. Control diabetes and hypothyroidism. So this is all about bacterial overgrowth syndrome.